Well, thank you everyone so much for being here. We want to get started because we know there's a lot to cover. Thank you to friends and family of the residents of Laguna Honda, residents that are joining us today, as well as local community members and advocates who are involved in and tracking the issues going on at Laguna Honda. We want to welcome you to today's town hall presentation hosted by California Advocates for Nursing Home Reform, along with legal assistance to the elderly and Bay Area legal aid. Really thank you for your time and dedication to this issue. We are all, I think, concerned. So we're going to jump into it. We are going to be sharing some slides, going over some of the resources that people can access, and talking about what's currently going on at Laguna Honda. So I'll turn it over to Patricia McGinnis, Executive Director of CANHR.
Hi, everyone. I'm going to talk about the current status and about their closure plan and some of the recent letter that Roland Pickens, the interim CEO of Laguna Honda, sent to the residents and families. In November of 2022, the City and County of San Francisco reached a settlement agreement with the CMS, the Centers for Medicare and Medicaid Services. They paused the involuntary transfers and discharges initially through February 2, 2023, and now through May 19th, 2023, which of course is coming up very quickly, and that's why the timing is absolutely crucial. They extended the payments through November 13th, 2023. The Laguna Honda was required under that settlement agreement to submit a revised closure plan, and that closure plan was submitted on April 18th. And I think we have a link to that as well in our PowerPoints. Meanwhile, one of the biggest problems is that CMS has given permission to resume discharges to community or lower levels of care for those residents who no longer require skilled nursing level of services and no longer meet the skilled nursing criteria. That, of course, is one of our big concerns. And one of the documents I saw that they have identified 50 residents who potentially don't meet that lower level of care, which is interesting since they meet it right now. And clearly Laguna Honda is billing Medi-Cal for their services. So we represented 2 residents previously when they went through this stuff, and they were discharged to homeless shelters, which of course does not provide any level of services at all. We won our hearings on both of those, and both of those residents were readmitted to the facility. The closure plan that was submitted on April 18th has a couple of interesting things. I'm not going to go through the whole thing because it's a 56-page document and you should take a look at it. I think it's on our links to this website. As of April 18th, 2023, and this was again, they're going to also notify of any further amendments. According to this closure plan, the patient census is now at 537. Which is pretty low, given that I think they started out in all this with 700 and something residents. We know that at least 57 residents were transferred. We know that 12 of those residents died shortly after their transfer to facilities that were not able to meet their level of care. The other issue is the fact that they laid out the patient census of those who are conserved by the public conservator, the public guardian, are 78. Pending conservatorship is 40, and with a surrogate decision maker is 301. So only about 154 people in Laguna Honda actually have they have capacity to make their own decisions. They intend to resume facility-initiated discharges for those who no longer require skilled nursing level of care. We haven't seen that yet. I know they have to do the notification requirements, and that's included in this closure plan too. The patient assessment, the initial and follow-up meetings, and they have to identify the beds to match with the patients. And I don't know how they're going to do that because according to their report, there are no beds. I mean, they've tried this before. We don't have any very, very few, although there are a lot of Medi-Cal certified beds in the San Francisco Bay Area, very few of those facilities will accept a Medi-Cal eligible resident, even though that's Medi-Cal discrimination, even though they're violating the law. But they said that only 368 Medi-Cal certified freestanding SNF beds are in San Francisco. So, I mean, obviously that is a big problem. So they say that the revised closure plan, the intent is to ensure safe, orderly, and clinically appropriate transfer or discharge. But that's one of the reasons why we are having this town hall. We want people to know what their rights are and what the facility's rules and responsibilities are. One interesting thing at the bottom of page 3 of the closure plan. When Laguna Honda is certified in Medicare or Medicaid, and the facility is allowed to admit new patients, then former Laguna Honda patients could expect to return. That's the first time, very first time we have seen that in writing, and we know about 150 Laguna Honda patients have been discharged. So hopefully that will be true. One of the other issues is that they may or may not be able to readmit residents. I mean, once the certification is approved, the recertification is approved, two things. Number one, there's a federal law that after anybody who's any facility that's recertified after November 2016, they have got to have a layout, the facility layout to have 2 residents per 1 bedroom, per the bathroom. So I'm not sure that those 120 beds that people have been talking about are ever going to be reinstituted. We are concerned about that. We are also concerned about the fact that whether or not they're going to start other discharges. One interesting thing is that I don't know if all of you saw the letter from Roland Pickens on May 1st, 2023. We can link that as well. But that was just what, Monday? Is that when it was? It looks, I mean, it's sounding very, very hopeful that they are going to be able to meet the milestones. And we are required to complete all aspects of the improvement plan by May 13th. So we'll see. The settlement agreement gives CMS the option to pause transfers beyond May 19th, 2023. And he indicates in this letter that they've been in constant communication with CMS about this. So we are hoping that they do get another extension. What we really are hoping for is they get recertified. Because I'll tell you, our experience with so many facilities in California is Laguna Honda is certainly not the worst. Meanwhile, take a look at the closure plan. They do have to do an admission freeze, and that's going to continue until they get recertified. They have to do the patient facility closure, transfer, and discharge plan, and they have to do a full assessment, and they have to ensure that there are safe and appropriate follow-up for residents. Because if they don't, that is going to be one reason why you can win a hearing and you can return to Laguna Honda. I'm hoping, I don't know how other people feel, but I'm hoping that we won't allow this facility. It's a major, major resource in San Francisco and a major resource for the residents of San Francisco, and particularly people who are aged and disabled in San Francisco. They don't talk about at all about the Flow project. One of the problems, of course, that we've had people visiting Laguna Honda and reporting back. And my understanding is that they are sorely understaffed as well. It would be interesting to hear your responses to that too. So meanwhile, I'm going to turn it over. If you want any of these documents, I'm going to turn it over to who? What will happen next?
That would be me.
Okay.
Hi, everybody. My name is Jacqueline. I'm a consumer and policy advocate here at CANHR. And so I'm just going to talk a little bit about residents' rights surrounding facility closures. So in the event that a facility is closing, the facility is required to provide residents with a minimum of 60 days advance written notice, which can be extended to an additional 60 days if needed. The facility also has to take steps to minimize transfer trauma, and that would include identifying the residents' relocation needs, and they do have to suggest alternative placements. If there are 10 or more residents who are going to be discharged because of the closure, the facility has to develop a written relocation plan, obtain state approval from the California Department of Public Health. And the transfer plan must include assurances that the residents will be transferred to appropriate facilities or other settings in terms of quality, services, location, and the facility has to take into considerations the needs and the choice and best interests of each resident. So later on, I'm going to be talking more about what discharges should look like when it's done appropriately. A lot of times, unfortunately, we see that discharges aren't done appropriately. So it's important for people to know what their rights are surrounding these discharges so that they know what steps to take to ensure that they'll be placed appropriately following either the facility closing or the need to be transferred for whatever reason. Next slide, please. So in the event of, with Laguna Honda, Laguna Honda will begin assessments of residents in all the units. They also will be issuing written notices out to each resident based on, depending on their needs and what next steps need to be taken for them. And it has to be issued to either the resident or the representative. If Laguna Honda finds an appropriate facility closure transfer location for any resident, it will be offered to them, and the resident still has the right to appeal any written discharge notice depending on how they feel about the discharge location that's being presented to them. Next slide. So just going over a little bit about nursing home discharge rights. So these are just general rights. We do have a fact sheet that's really helpful on our website that outlines very clearly nursing home discharge rights. And so the facility has to provide the notice to the resident in writing. Again, if it's a discharge related to the facility closing, then it has to be given 60 days in advance. If the reason is anything else, so it could be like their health has improved sufficiently and they no longer require that level of care, then it would have to be a 30-day written notice. So the reason for the discharge has to be legal. On our fact sheet, we do have the 6 legal reasons that a nursing home is legally allowed to discharge a resident. So it has those listed if you'd like to review those. And so on the discharge notice, it has to state there'll be the 6 legal reasons listed, and it has to have them either circled or checked off and clearly stated which reason the facility is claiming. And depending on the claim that they're giving for the discharge, the facility has to provide documentation for that reason of discharge. And the facility has to prepare and orient the resident for the discharge. So they have to go through the discharge location. They have to make sure that the resident feels that it's safe and they're comfortable with that. They have to take steps to reduce transfer trauma. And all of this has to be communicated and gone through with the resident and or their representative. And the facility also has to perform a discharge summary. Next slide, please. So the written notice should include contents that are required by the Code of Federal Regulations. So it has to be out it has to have the reasons for the move, the effective date of the move, the proposed location, information on the appeal rights, and contact information for the California State Long-Term Care Ombudsman. And it has to have all of this information in the notice, which we'll be discussing later, specifics about what documentation needs to be required. But essentially, if any of this information is missing, then it's not a legal discharge, and the resident has the right to appeal with the Department of Healthcare Services. Next slide, please. And I believe we are transitioning to John. Am I correct? Nope, this is still me?
Yeah.
Okay. And so to further reiterate on the documentation that's required, the facility must have adequate documentation in the resident's records to support the reason for discharge. So that has to include the current assessments, it has to include their care plans, and it has to have a physician's order citing the reason for discharge. So a lot of times we see facilities claiming that the resident's health has improved sufficiently, so they no longer require skilled nursing level of care. And if that's the facility's reason for discharging a resident, then there has to be clear documentation in their chart that shows that they are ready to be discharged to either maybe assisted living, if they have a home to return to, or if they need to find housing, the facility has to find appropriate housing for them and go through that entire preparation and orientation process. But it has to be clearly documented in the resident's chart to show that that their health has improved so much that they're ready to return to a lower level of care. And the facility also has to send the receiving facility. So if they're transferring to either assisted living or to a different skilled nursing facility, they have to send the receiving facility all special instructions or precautions for ongoing care. And they also have to communicate with them the comprehensive care plan goals. And then I think now we're transitioning to John.
Thanks, Jacqueline. My name is John Hafner. I'm a staff attorney here at CANHR, and I'm going to talk to you a little bit about discharge appeal rights. So every resident has the right to appeal the discharge and to have a hearing with DHCS. Now, when I say hearing, it's not a formal court hearing, but rather more of an informal conference call. But most importantly, once you assert your appeal rights and contact DHCS to appeal the discharge, they will put a stay in place, which will prevent the facility from transferring the resident during the pendency of this discharge appeal hearing. I did want to point out that the notice of discharge you would receive from the facility is separate and distinct from a notice of coverage ending. Both have separate appeal procedures. So the notice of discharge that you'd receive from the facility, the issue is whether the discharge is lawful and safe. The notice of coverage ending, the issue is, will the insurer pay for continued coverage? So certainly contact us if we can be of further guidance to either notice. Next slide, please. Okay, so I'm going to take you through the appeal process, the discharge appeal process. So once a resident receives a notice of discharge from the facility, then the next step would be to appeal that discharge by contacting the Department of Healthcare Services, DHCS, the Transfer Discharge Unit. And there is the number provided. You'll likely speak with a very nice lady by the name of Tiffany there, who will help you process that appeal. So these hearings, again, it's an informal conference call. It takes about 1 or 2 weeks after the appeal is filed to schedule and have the hearing. And then after the hearing, it usually takes 1 to 2 weeks to receive the decision. So at the very least, asserting such an appeal does buy some extra time, regardless of the result. So again, I mentioned before that discharges are suspended during the appeal process and while waiting for the decision. Medi-Cal coverage is unaffected by residents exercising their discharge appeal rights. And even if the resident loses the administrative appeal, the facility still cannot forcibly remove the resident. They would have to go and obtain a court order through a forcible detainer action prior to removal. Next slide, please. So anticipating a few of the reasons that Laguna Honda will likely attempt to discharge some residents and where they will attempt to discharge them to, I just wanted, with a very broad brush, to discuss some defenses and certainly invite you to contact us for further guidance. As Pat mentioned before, there were a number of attempted discharges to homeless shelters. So the defense there would be, can the shelter guarantee the admission for the resident on that proposed discharge date found in the written discharge notice? Most shelters, to my knowledge, cannot guarantee placement in their facility. So therefore, the discharge is unlawful because the discharge notice fails to provide adequate notice as to the location in the notice itself. Also, need to ask, can the shelter provide the care and services needed, including therapy and medication management? Most often the case is no. So therefore, the argument would be that the discharge unlawful. It's an unsafe discharge because the discharge fails to meet the needs of the resident. And then also, as discussed, due to the limited number of beds in San Francisco, it's likely that there will be an attempt to transfer to facilities that are outside the region. If there's a strong objection to that, you may wish to argue that that would be detrimental to health and well-being, as family and friends would be excluded from visiting and supervising care. But that would really have to be weighed as you look at the available options. Next slide, please. And the most likely anticipated basis for discharge would be you no longer need a skilled level of care. So with a very broad brush, you need to identify whether or not the resident has received a proper written notice of discharge. Again, that notice needs to include with clarity the location and date of discharge, that the notice is provided sufficiently in advance, that the appeal rights are stated in the discharge notice, including how to contact DHCS for appeal, and that a copy of the notice is provided to the ombudsman. I would say around 50% of the time, just on a procedural basis, you can win the appeal just because the facility did not provide a lawful written notice of discharge. After appealing the notice to DHCS, but before the hearing, the facility will have to, if they wish to prevail in the appeal, submit all relevant medical records to DHCS and the resident that demonstrates that the resident no longer requires a SNF level of care. Most of the times, facilities do not do this. In addition, the facility must also submit a discharge summary from the resident's physician, not just any physician. And most importantly, the facility has the burden of proof to support that the discharge is lawful and safe. If the facility has not submitted any medical records in advance of the hearing, then the facility simply cannot prevail in the appeal hearing. testimonial evidence alone offered at the hearing by the facility is not sufficient to carry their burden of proof. They must show evidence in the medical record. Like I said, most times the facility will not provide these records in advance. Sometimes they will try to submit them during the hearing. I would always object to that taking place because there's always a deadline. They've missed the deadline. They can't submit this evidence now because that would prejudice the resident. So again, and then if they do submit records, use those records against them to show that a skilled level of care is required for the resident. Specifically, I would look at ADLs, activities of daily living, medication management, and the most recent care plan and any nursing notes that would indicate that the resident needs a skilled level of care. But most importantly, those are just broad brushes. Call us for further assistance and guidance. Next slide, please.
Thank you so much, John.
Can I just add something too? In one of the correspondence, they've identified 50 people at Laguna Honda who they say no longer need a skilled nursing level of care. So be on the lookout for if they get proper notice, and please let us or LAE know about this.
Yeah. So as John mentioned, CANHR can provide guidance on any notices that residents receive, but we also work very closely with local legal services organizations, and we want to highlight these partners today. So first, I'll turn it over to Carol from Legal Assistance to the Elderly, who's going to talk briefly about their available services.
Good morning, everybody. Thank you. Yes, my name is Carol Betancourt, and I'm a staff attorney here at Legal Assistance to the Elderly in San Francisco. And we can provide free legal services to anyone who's a San Francisco resident, who's 60 or older, or who receives government disability benefits. So you don't have to be elderly if you do receive disability benefits. And I do healthcare related work. So if people do get discharge notices, I could help them with that. Also, I think Jacqueline mentioned the possibility, or maybe it was John mentioned the possibility after the process of maybe a court action. We also have attorneys here who do eviction defense if it does wind up in court. So we could potentially help people with that as well. And so I would encourage people, if they get a formal discharge notice, call us. But even before that, if they have questions about this process and that everything that we just covered, because it's a lot of good information, but it's a lot of information, call us and I can try to talk them through the process. And then if they do get a notice, we can help with that. Thanks.
Thank you so much, Carol. Next, I'll introduce Jessica from Bay Area Legal Aid.
Hi, everyone. Thank you to CANHR for this great presentation and for having me here. So similar to Legal Assistance to the Elderly, Bay Area Legal Aid is a free legal service. And so we have both the Health Consumer Center, which the phone number is listed here for anyone who has questions about this process as well. I'm also a supervising attorney for our housing unit, specifically in San Francisco. And so we can also assist any resident who gets a discharge notice and, has questions or wants to challenge it, or if the case does end up in court. A large part of our practice is doing that eviction defense and helping residents through that process as well.
Thank you, Jessica, so much. So now we are going to switch gears a little bit and look at some of the options that exist for those individuals that are considering, their options and what resources may exist if they do need to leave Laguna Honda, or if leaving might present some better opportunities for a living situation. So I'll turn it over to Pauline Shatara, CANHR's Deputy Director.
Hello. So one of the things I wanted to mention, which is, more of something to think about, is planning ahead and considering your future options. Of course, the future of Laguna Honda is uncertain. We're hoping they are recertified, but it seems as though even if they are recertified, maybe over 100 residents may still be discharged. And so it is a good idea to think about what alternatives may be acceptable, especially if everybody's going to be, being discharged at the same time. They're competing for the same amount of beds in San Francisco, which there aren't many, or surrounding counties. So it would be good to consider and maybe start researching. Are there other counties that you may have family or friends to support you, and what facilities would be acceptable in those areas? It might be a good time to just identify what those facilities are, talking to them, maybe visiting, doing those things ahead of time, just so that you can be comfortable that you have an alternative in mind if that were to happen. The assisted living waiver is very limited in San Francisco, but there are other counties. If you're willing to move to another county, the assisted living waiver program may be, there may be a shorter wait list in other counties coming from a skilled nursing facility. You would be prioritized, and there's also home and community-based services that Bea will talk about later. So something to consider. Of course, the goal would be to stay if that's what you're wanting to do. But if you're actually not wanting to stay, and it's something, if you were wanting to find an alternative placement, it would be good to look. If you can call CANHR, we can explain how to look for facilities. And also many people, from looking at the closure plan, the majority of residents in Laguna Honda, 415 of them are actually enrolled in San Francisco Health Plan. And 20 of them are enrolled in the managed care plan, Anthem Blue Cross, and 97 are enrolled in straight Medi-Cal. So for those participants who are in a managed care plan, you'll also be getting assistance through the managed care. So one of the things that both managed care plans provide, Anthem Blue Cross and San Francisco Health Plan, is enhanced care management. I had a discussion with San Francisco Health Plan yesterday, who has the majority of residents enrolled, and they said they have been in communication with Laguna Honda. They are aware that there may be a large transition and a lot to prepare for, and they're expecting to get a list from Laguna Honda of what residents are going to be in need of the enhanced care management. So it most likely would be that the people enrolled in San Francisco Health Plan wouldn't even need to do anything, that they would be contacted about enhanced care management and given additional resources to help figure out next steps, what they would be, if it's going to be placement in another facility that's going to be covered by the managed care, or what other community alternatives there may be, or possibly referrals for home and community-based services. So the good news is they are aware, and they are thinking and planning ahead in that case. San Francisco Health Plan only has the enhanced care management. Anthem Blue Cross, on the next slide, has additional services and supports available. If you are in San Francisco Health Plan and you're thinking that you would prefer to be an Anthem Blue Cross because you want to access some of these additional services, you can change your managed care plan. That could be another alternative. Services available to the Anthem Blue Cross members. There's nursing facility transition, diversion to assisted living facility. So the managed care plan could pay for someone to be in an assisted living facility instead of skilled nursing. Community transition services to home. So that could include housing deposits, help identifying what community programs are available and necessary, identifying where to live, signing paperwork, things like that. Personal care and homemaker services. Sometimes people may be considering in-home supportive services, but that takes a while to kick in. So through Anthem Blue Cross, you can get these similar types of services in the interim while you're waiting for IHSS to be approved. Environmental accessibility adaptations. Some people may have a home, but they may need some modifications in order to return home. Maybe they need a ramp for a wheelchair. Maybe they need their bathroom modified. These are things that the managed care plan could pay for. Housing transition navigation services, deposits, and sustaining services, assistance with things that may come up after the person's already a tenant in that housing. So Anthem Blue Cross does offer these additional services. You'd have to talk to the managed care plan and see what services they would provide. And I'll turn it over to Bea.
Thank you. And so I'll be talking today about the home and community-based services programs available in San Francisco that help transition individuals from the skilled nursing facility back into the community. In this case, there are 4 programs available. So the first one, next slide, please. So the first one is going to be the California Community Transitions, also known as CCT. And to apply, you'll have to contact the CCT lead organization. There are 2 in San Francisco. One is Star Nursing and the other is Institute on Aging. And we also included the coordinators information on the slides. So once the person applies for CCT and is approved, the transition coordinators will assist the applicants in finding housing, setting up assistance in the home, whether it's through assistive devices such as home modifications or other devices needed, or in-home care. CCT will stick with the beneficiary for a year to ensure that they have the services in place that they need to remain safely at home or whatever setting they end up choosing. And then if you contact, because there are 2 in San Francisco, if you contact one and don't hear from them, I highly suggest contacting the other to see if you can get a hold of someone quicker that way and get your application in. Next slide, please. So the next program is the Assisted Living Waiver Program, which Pauline briefly mentioned. It's also known as the ALW. The program allows skilled nursing facility residents to live in an assisted living facility while Medi-Cal pays for their care and services. To be eligible, the person has to have Medi-Cal with no share of cost, meaning as of this year, the income has to be less than $1,677 a month. There is a wait list, but nursing home residents receive priority because they're institutionalized. And then to apply, you would have to contact the 2 care coordination agencies in San Francisco, which again is the Institute on Aging and then NorCal Care. The care coordination agency will help you with the application and then place you in a participating facility once you're approved. As Pauline mentioned earlier too, the assisted living waiver has very limited slots and even more limited in San Francisco. So some of the nearby counties that participate in this program, if the resident is willing to move, are in Alameda, Contra Costa, San Mateo, and Santa Clara. And then I don't believe we have it here, but I can include it in the chat. You can find the care coordination agencies for those counties on the DHCS website, which I'll include in the chat as well. Next slide, please. So the Home and Community-Based Alternatives Waiver, it provides case management services and supportive services to beneficiaries either in their own home or in a congregate health living facility. The person must have Medi-Cal, and they'll likely have the beneficiary apply for in-home supportive services as well to see how many hours that person can receive through IHSS. And then the HCBA or home and community-based alternatives will then supplement those hours. Sorry, not sure what's happening. But
Sorry.
no problem.
Computer decided to update in the middle of the presentation, so I apologize.
No problem. So the other thing with the home and community-based alternatives waiver is that if you are someone or if you know someone, or if the resident's going to need 24-hour care, the home and community-based alternatives waiver is one of the programs that can get you as close to 24 hours as possible. given that they also work with IHSS to provide these services for the person in the home. To apply, the waiver agency is Institute on Aging, so you would have to contact them to begin your application. Next slide, please. All right. And then last but not least, people can also contact in-home supportive services for assistance in the home. They provide help with household chores, personal care services, protective supervision, and paramedical services. Depending on the applicant's level of care, a person can receive up to 283 hours, and then the IHSS provider can be any person of their choice. So it could be a relative, a friend, someone that they know. I will say that if you do have someone in mind, great. If you don't, there is an IHSS registry available. It's just that if the registry has limited number of providers, there may just be a wait until you are able to get a caregiver in the home. Thank you. The thing with this program, in-home supportive services, is that it cannot be combined with programs like the assisted living waiver, or even if you are in an assisted living facility, you cannot apply for IHSS, mainly because the expectation is the facility should be providing the services that IHSS would provide. So to receive this service, you have to be in your own home or outside of a care facility. And then I believe that's it. And then I'll pass it on now to Jessica Lehman from Senior Disability Action for additional information about housing.
Thank you so much.
Welcome.
Hi, everyone. Apologies to be on my phone, just stepping in here. Thank you so much to those who have put on this event today and are working so hard to make sure people get what they need. So my name is Jessica Lehman. I use she and her. I work for Senior and Disability Action, and I'm part of the San Francisco Long-Term Care Housing Task Force. So I wanted to mention a couple things that we've been working on in the context of community transitions. The crisis at Laguna Honda Hospital points to an issue that disability rights advocates have been working on for decades, which is the need for more available and funded home and community-based services. You've obviously heard about some of those today. I see the comments in the chat about how hard it is to even access some of what's available in terms of funding. And in San Francisco, of course, we've talked about especially the lack of and deep need for deeply affordable housing, not just what's called affordable, but housing that will really work for people on SSI and other very low incomes. So in March, we held a forum called Rethinking Community Living. I know some of you were there. We had some videos of residents at Laguna Honda Hospital talking about what it would be like to live in the community. And we also had other people from the Bay Area talking about possibilities to make community transitions possible. And that video is, the recording of that forum is available if you'd like to see it. Thank you so much to Maura for sharing the information in the chat. So we are going into the San Francisco budget cycle now for next year's budget. And so want to invite folks to join the push for funding for things like disability operating subsidies, which would be a new program to have housing that's accessible to people at SSI level, as well as portable rental subsidies for seniors and people with disabilities, including people who are HIV positive. And I just want to say, one issue that we're having in talking about home and community-based services is that it's really problematic about who gets deemed by staff at Laguna Honda and just by our society in general, who gets deemed as being able to live in the community. And that we all know we could think a lot more broadly about what would it look like to have the right services and supports in place to make it possible for people to live in the situation that they want. So I want to invite folks to join this effort to push for funding, to push for more options for people in nursing facilities, We have a survey that came out of the forum in March. The first part is about the forum. You can just ignore that. But near the end, it invites folks to get involved. So if you want to fill that out, I believe that survey has been or will be shared in the chat as well. And we look forward to working together to make sure that people can live in the community as much as possible. Thank you so much.
Thank you, Jessica. This is Pat. I just want to make a couple of comments. One of the problems with our home and community-based services programs, people talk about a long-term care system. We don't have one. We don't have one in California. We don't have one at the federal level. You can get access, you can try to get access to these different programs. There's no central application agency. Every single program has different eligibility requirements. We have wanted and worked for years to try to get a centralized application, centralized eligibility requirements, etc. I just want to emphasize, however, our goal is not to encourage people to just go and get, if they are eligible and they can do it, it's always better to try to live in a home and community. It's always better to live it. I never met anyone. Oh, I can't wait till I'm 95 years old. I get to go into a nursing home. People want to be able to stay at home if possible. If they can't stay at home, they want to be able to find a community-based option. They want to find something other than an institutionalized setting. I just wanted to tell you, though, our goal at CANHR and the other advocacy organizations is to stop the transfer, to get Laguna Honda recertified, to allow new admissions, and to allow the people who have been discharged to become back into the facility, and to allow in San Francisco one of the best nursing homes, long-term care facilities possible. And that's our overall goal. But we do want people to be aware of what the community-based alternatives are. And we have some wonderful partner organizations here. Any questions? Maura, are you going to moderate now?
Yeah.
Okay.
If there's any questions, please write them in the chat, or if you'd like to raise your hand. Art, go ahead and unmute yourself.
Yeah, I just wanted to point out that there are things we can do to prevent, hopefully the optimism that was expressed by the Pickens will be come out to be true. But if you look in the chat, I just posted a link to things you can do to help prevent Laguna Honda's closure and more transfers of residents. So, for example, this afternoon, there's a SF Health Commission hearing, 4 p.m. And if you click on that link that I just put in the chat, there's information about that. But now the next 2 weeks are crucial to saving Laguna Honda and preventing further potential deadly transfers of residents. Thank you.
Yep. Thank you, Art. And thank you for all the work that you do on this too.
If anybody else would like to either raise their hand, or if you have a question or comment that you want read in the chat, Teresa, if you'd like to unmute yourself.
Oh, hi, can you hear me? I've been very active, and I with the help of the Gray Panthers, we have a website on Laguna Honda where we try to use it as a resource that people can go to. And I've just updated the website, so links to the resources from this this seminar are in there. And we're also we don't know what's going to happen between now and the next 2 weeks, but the Gray Panthers are going to have a forum May 16th from 1 to 3, where we will ask the folks that know the most to update everyone on what's going on in Laguna Honda. If by some miracle, by May 16th, the beds have been saved and the discharges have been stopped, we need to talk about how to make sure this never happens again. But I have a feeling that we'll still be talking about how to stop it from happening. So I'm going to put the link to this event in the chat right now. Thank you.
And I also encourage everyone to read Joseph Urban's essay on the transfer and relocation. Joseph has also been extraordinarily active in the petition in trying to save Laguna Honda. So we appreciate Teresa and Joe and Art and all the work that the Gray Panthers and the rest of you have done to stop this. I don't think we would have these pauses without your advocacy. There is no question about that.
And for anyone that might have trouble accessing the chat, we will be doing an email later on today with a link to the recording of today's presentation, the handouts, all of the different resources and links that have been shared in the chat today. Are there any other comments or questions at this time?
Has anybody received a notice? Whether you have relatives or friends who have received an actual notice from the department besides the letters that Pickens has put out? Well, if you do, please let us know, let LAE know, let Bay Area Legal Aid know. It's very important. Betty, you have a question?
Yeah, my question is regarding the loss of the 120 beds because of the requirement for only 2 rooms per bed, two beds per bathroom. At Laguna Honda, as anybody that has visited a patient there or a resident, which I have, the rooms are very large compared to other nursing homes. So to me, this requirement is just not needed, and it should be by size of the room and the way and the architecture of the room. Each patient in the 3 bed rooms have their own little area at Laguna Honda. And I will say that this is not something that's coming. I think it's already happening. The person I visit now has only herself in her 3 bedroom, and she was actually moved herself in the beginning to another room, and then they moved her back. But anyway, is there any way we can stop this loss of the 120 beds, especially at Laguna Honda, when it's not needed, in my opinion?
Benson, you have a response to that?
Can you hear me? First of all, my understanding of the 120 beds, as you said earlier, Pat, was that because of the tenuous nature of recertification, this new law kicks in for Laguna Honda, but not the existing skilled nursing facilities that are not in the same situation of having a tenuous certification issue as Laguna Honda does. So
Right.
if there's any way to reverse that, I mean, it would be an interesting kind of attempt, but I wanted to comment on the fact that we local ombudsmen are in this facility pretty frequently, and we're talking to actual residents. And we're also getting all the transfer discharge notices sent to us per CMS and state of California statutory requirements. And so far, we've not really seen any transfer notices coming in through that email system, as well as any discharge notices yet, but we're monitoring them on a day-to-day basis. And you're quite right. The next 2 weeks are going to be maybe sea change in terms of what Laguna Honda is doing. Right now, the focus, and this is coming from people that we talk with who work at Laguna Honda, the focus right now is on COVID. They have an outbreak with 90 residents who are COVID positive, and it keeps on increasing as more people are moved in and out of 2 designated quarantine rooms. And the second focus, as you might infer from the CEO letter, is that they're still trying to do better and meet all the metrics so they can get accepted for certification by CMS. So I don't see any indication as of today and last week of any notices increasing for either discharge or transfer. That's not to say that they're not going to be coming at the end of this week or next week. So that's one of the things that our local program is looking at. And because we know a lot of the residents who are maybe slated for a lower level of care, we're going to be talking with them as soon as they get a letter. And the problem with the previous process was the letters coming into the local ombudsman program were dated a few days before the actual departure from Laguna Honda, with no lead time for any reasonable conversation with an ombudsman or any filing of an appeal. And that fast track notification process was brought to the attention of CMS when they were looking at the relocation process before, brought to the attention of David Hsu, the city attorney, and brought to the attention of the city attorney that's working within Laguna Honda. And so we're hoping that if the notices are issued, they're not going to be at the last moment. And the comment I want to make about the previous relocation and life process, which I hope doesn't repeat, was that family members were convinced that if they don't grab a bed locally, and let's say in San Mateo County or Alameda County, then they're going to go far, far away. And that kind of coerciveness on the part of families, particularly those who did not speak English, was one of the reasons why so many people went to other receiving facilities where those residents remain pretty unhappy with where they are right now. So we're going to be monitoring the communication with family members if this comes to be again, to make sure that the family members have knowledge of all the resident rights, of a choice of an alternative. And we look forward to any residents who do want to appeal a discharge or a transfer, that we fast track them to CANHR or to LAE so they get some degree of legal representation. So that's what I wanted to say.
The other thing, Benson, is I don't think that that's going to happen this time. One of the things I noticed in his letters, in Pickens' letters, and in the closure plan, they actually lay out the residents' rights, which they didn't do the last time. They also got, 11 or 12 citations from the Department of Public Health, all T-transfer notices. So hopefully they won't do that again. And
yeah,
we're $3,000 a citation. So.
Yeah, we looked at the citations issued based on that process, and we're hoping that that's a corrective action for the next phase if it ever has to happen. But the Ombudsman program right now, talking to residents who are a lot more adamant that this place is not going to close down. We're going to dig on our heels. We're not going to facilitate relocations as part of some kind of process, but we're going to say, don't go, no, refuse to go, because quite frankly, family members particularly were scared into a possible closure, and it didn't close. So we're going to take a position of refuse to go, don't go.
Great. Teresa, you had comments?
Yeah, isn't the Ombudsman Office itself authorized to supply legal lawyers rather than depending on the nonprofit? Aren't you funded by the government to legally represent patients?
Well, Terry, in the past, historically, ombudsmen have actually participated in some of the discharge hearings for people that didn't want to go, even though we're not legal. It takes a fair amount of lead time and preparation. We need to get a copy of the chart. And we've done that very sporadically, but not during this more recent scenario of the relocation. We really want a more effective representation than what the ombudsman can kind of do as an ad hoc. And again, we're not lawyers.
Okay, thank you.
Yeah, their mandate under the Older Americans Act is to investigate and resolve complaints made by or on behalf of residents. And when the ombudsman first started, they actually had a legal services developer. They actually worked in partnership with legal services. And the ombudsman does with LAE in San Francisco. And we work very closely with the ombudsman as well, all over California. And of course, there's Bay Area Legal Aid too. There are a number of legal services groups in San Francisco that have the capacity to be able to represent clients. And then Benson can refer people to any of the legal services groups around, so.
Okay. Well, thank you everyone for your time and for, definitely your dedication and passion about this issue. We know many of you on the call today have a loved one that is resides at Laguna Honda, but many of you do not and are just, really involved in this issue and trying to advocate for to keep this wonderful San Francisco resource. So want to thank all of the speakers for a great presentation and for their time, for our partner organizations that joined us today. And again, we'll be sending out links and resources that were shared in today's presentation and hope to stay in touch with everyone as things move forward. So take care, everyone, and have a good afternoon.